The first video that I saw of yours personally was the one, like you mentioned, where you were actually having to scrub out of a procedure where you said the patient was literally asleep and unconscious, about to operate on them in order to speak to this insurance company.
I got a phone call into the operating room saying that United Healthcare wanted me to call them about one of the patients who was having surgery today, who was actually asleep having surgery, and said I had to call right now. So I scrubbed out of my case and I called United Healthcare, and the gentleman said he needed some information about her, wanted to know her diagnosis and um, whether her inpatient stay should be justified. And I was like, do you understand that she's asleep right now?
Is this common across the medical field that doctors have to do this?
I was shocked that I was reached in the operating room, but it is absolutely the case that doctors are interrupted in the middle of patient care every day to deal with insurance issues. And I'll give you a specific example. So when I, for instance, want to do a breast reconstruction, I might call United Healthcare and say, I want to do this surgery. And they say no. And I say, well, what's my recourse? And they say, you could have a peer-to-peer conversation about this. And I say, okay, I'd like to do that. Let's schedule it. And then they tell me our only time slot available is at 3 p.m. today when I'm in the operating room or in clinic. And then they say, if you don't do the call by 4 p.m., we're going to deny it. So it's like, drop everything, show up, jump when we say jump, and go as high as we ask you to go. And then usually, I get on and they say, well, we're going to deny it. And then I have to appeal. So I think the principle that doctors are interrupted constantly to deal with insurance issues is a really important one. And being called out of the operating room was crazy, but it was also, it was just taking it one step further. And doctors from around the country reached out to me and said, I can't believe that, in the letter that United sent to me, they said, oh, we would never do that. And doctors around the country called BS on that. They were like, no way. No way. They do it all the time.